All right, well, thank you so much for having me and for joining me today. My name is Ali Moehring, and I am a health communications specialist in CDC's Division of Cancer Prevention and Control, where I lead two of our national public health campaigns in the division. I will give you a bit of an overview of those campaigns and then speak more specifically to how we communicate to our audiences about the importance of family history when understanding your risk of cancer within those campaigns. But the overview of the campaigns is going to be really high level so that we can kind of get into the details. So pulling back a little bit, just to tee up the two campaigns that I'm going to talk about today, and those are Bring Your Brave and Inside Knowledge. Bring Your Brave is a campaign mandated by the Education and Awareness Require Learning Young or Early Act, a piece of legislation meant to educate women between the ages of 18 to 44 about breast cancer risks, signs and symptoms, and hereditary breast and ovarian cancer. And also address the needs of young breast cancer survivors and women living with a known risk, also known as previvors. Um, and it encourages them to really take action to learn and manage their risk. Inside knowledge is a component of a piece of legislation called Johanna's Law and focuses on education and awareness of the 5 main types of gynecologic cancers in women. So that's vaginal, vulvar, cervical, ovarian, and uterine. For inside knowledge, we have individual messaging and audience strategies for each of those cancers, and we really try to steer clear of any messages that lump those cancers together. We know that they all have different risk factors, but we also know from our research with these audiences that many women don't know the term gynecologic cancer or what all of those cancers are. So for us, when we say gynecologic cancer, we really try to untangle that and speak to each of those cancers individually. Where these kind of cross over, I'm sure as this audience understands, there's a lot of it. We do leverage similar tactics in sharing messaging around family cancer history. Both of them really we have to really push to the audiences the importance of understanding their family history of cancer, both what to know and why it's so important, all in order to help these audiences prevent cancer or catch it early. We speak broadly to the importance of knowing and understanding your full family history of cancer, and also think specifically about each of those cancers and make it relevant to each of the audiences. I will say, one thing we've been really shifting recently is instead of kind of thinking really individually about each of those cancers and all of the cancers that might be associated with BRCA, with Lynch, with each of these genetic components, we really just want our audiences to just kind of think broadly. What does the picture of cancer look like in your family? And think about all of the cancers that run in your family and start to jot those things down and bring them to your doctor. So we're kind of really wanting people to look at that full picture and maybe not think so much about those specific cancers quite as much. So this is a very busy slide, and there's a lot more where this comes from. But just at a really high level, I wanted to give you a tiny little preview of some of the most recent research we've been doing. Ongoing formative research, whether it's message testing or in-depth audience research, it's a part of all of our campaigns in the division. This is just a really short synopsis of some of our most recent findings from the research that we're still building upon right now. So some of this is still in process, but I wanted to share just a little bit of it. So for the Bring Your Brave campaign, we've recently done our first focus groups with previvors. So these are women with a known genetic mutation that raises their risk for breast cancer. And some of the things we've heard so far, most learned their breast cancer risk after a first or secondary relative was diagnosed with breast cancer. Which probably, I don't think that was a super surprising finding. Many described being dismissed because of their age, when they sort of asked about genetic counseling and testing, and really describing having to advocate hard to get the appropriate or to get to genetic counseling and testing in the first place. And when they did test positive, to get the appropriate screenings and procedures that they wanted to lower their risk. So just a lot of fight and a lot of self-advocacy that these audiences had to really do for themselves. And there are audiences that, took this step to really learn their risk, but still are unaware or confused about the appropriate screenings or the surgical interventions that are available to them. So there's still a lot of work to do with this audience. And again, this is just a very preliminary look. We're still doing this research. We're expanding on this right now. But we know there's going to be some work to do here. We also recently did some additional research with audiences that are unaware of their risk, expanding on other research we've done with these audiences in the past. Participants were generally unaware of risk factors related to early onset breast cancer and what steps they could take to understand their risk beyond knowing family history, and sort of also what next, right? Like after learning your family history. In terms of inside knowledge, our recent focus groups, they really kind of underscored things we had learned in the past. There's a moderate understanding of the importance of family history. So, most women understand that there's that connection there. But I think, again, similar to our Bring Your Brave audiences, maybe a missing piece of what happens next or what do I do with that information. I think what was sort of concerning is that the risk factor awareness was a bit lower among younger women, and there was a perceived lower risk among older audiences, which certainly was cause for concern. And a lot of these women that we talked to in this round of research had stopped regular gynecologic care after menopause or after childbirth. This was in the 56 to 65-year-old age group. Many of them felt like if they had no family history, they didn't have a risk. And if they didn't have access to their family history, they kind of didn't want to explore their risk further or didn't think they needed to. In terms of what's next for this campaign, we have a lot of message and materials testing coming up, and we also are taking a look at putting some materials in front of members of the LGBTQ plus community to understand their awareness levels and experiences with gynecologic care. So just to dive into our messaging, I teased this out a little bit, but this is sort of where things overlap, but kind of overall how we message family history based on the focus groups that we've done and kind of where we landed with everything. Again, it's starting by learning about the family histories that run in your cancer, or family cancers that run in your family, excuse me. And this note here that I mentioned earlier, where we really used to kind of talk about looking at cancers in women and men, ovarian, prostate, pancreatic, if we're talking about BRCA. And we're really shifting to kind of just telling people to emphasize, look at all of the cancers. Do you recognize any patterns? What does the overall picture of cancer look like in your family? Is there this nagging feeling that there's just a lot of cancer here? That's the kind of message that we're kind of working on now. How can we instill in these audiences that we just want you to recognize if there are quite a few cancers in your family, you should dig deeper into that information and bring that to a doctor. Another thing that's really important, especially because, our audiences are mainly women, a lot of them don't understand, especially with the gynecologic and breast cancers, that this can come from both sides of your family. When we're talking about a genetic component, they think of just their maternal side. So know both sides of your family is a really important message for us. Sharing that with a doctor. So, again, this is like a step-by-step process. It's a very complicated messaging process. So learn it, know both sides, talk to a doctor, ask if genetic counseling is right for you. We push genetic counseling very hard, not just genetic testing. And then I think that we also have to acknowledge that there are a lot of women, and we know this from our focus groups too, that don't have access to that family history. And we try to figure out what that message could be for them. We do at least want them to talk to their doctor about what what they can do to help them understand their risk. And then I think the main thing we've learned over and over again from our research and when we talk to audiences is that there's a lot of fear when they don't know what to do with this information. So if you just tell them when your family history could indicate a risk that you have a higher risk for cancer, that just instills a sense of fear that can kind of paralyze some women because they don't all know that there's something you can do about it. So a big piece of the message has to be when you know your risk, there are steps you can take to lower and manage it. So it's a lot of work to get from point A to point B. All of these things have to kind of fit in some way because when women don't know, oh, I can do something about it, the rest of this just kind of gets lost. They don't want to uncover this information. So this is just sort of a sample of some of our static social content. As it relates to hereditary breast and ovarian cancer and understanding family health history, we really strive to create as many co-branded materials between the two campaigns, representing both campaigns as we can. We use these types of graphics in organic social media, paid social, anywhere we can kind of get the word out in social media. And these are, informed by research. Sometimes they are put in front of people, message tested, but they're all rooted in research for sure. And then I'm just going to go into kind of a sampling of some of our video content. I think especially for Bring Your Brave, our audience is younger for that. I mean, our inside knowledge audience, it can go young, but it also goes up to 65, whereas our Bring Your Brave audience kind of caps at 44. So for us, for Bring Your Brave especially, and as I mentioned in that previous slide, it can be so hard to tell that point A to point B story. We always say storytelling is really the backbone of that campaign. And when we can find other women who want to tell that story for us or on behalf of us, it can be so much more effective than CDC trying to get that information out there directly from us, right? So when other women want to sort of advocate for this and get their stories out there and try to share this information, it can be so much more effective. So a lot of what you're going to see will reflect that. So I'm just going to show you a few examples of some of our video content. So just taking a step back and then I'll kind of show you, do a little show and tell. So on the Bring Your Brave side of things, our Thread of Bravery and Not Afraid of First video series really encourage women to be the first to start the conversation. So again, taking a step further back, each of our videos on both of the campaigns, we kind of need to meet women at each of those entry points that I went into in the messaging slide. So you're not even ready. You haven't even started the conversation with family members or you don't know yet. We need to kind of get you there. You kind of have a little bit of information, but you haven't talked too much about it. Let's get you there. You maybe don't know where to start with your family, talk to your doctor first. So all of our videos are trying to meet you at different points in time. So Thread of Bravery, these videos feature real women who know they have a family history, but they haven't yet undergone genetic counseling and testing. So through a closet haul, they sort of share some of their family's fashion history while weaving in stories of some of the cancers that have affected their families to share what's sort of prompting them to see their doctor or see a genetic counselor to talk about genetic testing. Not Afraid of First is more of a sort of like empowering, I can be the first in my family to have this conversation. The generations before me haven't wanted to talk about cancer, but I can be the first to do that. Bring It to the Table is, again, just kind of like, I've heard about these different cancers in the family, but when we sit down tonight, I'm actually going to bring it up and kind of talk about that. What's on her mind is kind of more for that person who doesn't really know where to start and maybe has to talk to her doctor or maybe doesn't have full access to her family information and doesn't really know, if I only have these two people that I'm close to, what do I ask? Maybe talk to your doctor first and find out what information is the best to get. We have another series on the Bring Your Brave side called Beyond the Diagnosis, and this is we did sort of a round table style of interview and dialogue videos featuring survivors and previvors. So, a room full of women affected by breast cancer. And I'm going to show you in a bit a cut down of one of our videos featuring previvors, just kind of sharing the different aspects of what it's like to live with knowing that you have a high risk. So let's start there. I'm going to share a cut down version of that video that is intended for previvor audiences. And again, when we talk to these audiences, it's similar to when we talk to survivors. There's this feeling of isolation and people not understanding what it's like to live with a high risk and have to get a mammogram and an MRI alternating every 6 months, and the scanxiety, as they call it, of it all. In this video series, whether the ones that are for survivors or the ones that are for previvors, we really just wanted to help other women that might see it feel a little less alone in those feelings. So I'll let you guys take a look.
I feel a little judged for wanting to get a mastectomy. It's maybe not the obvious choice, but the thing that's hard to explain to someone who hasn't gone through it is every 6 months having to deal with the healthcare system and showing up for a stressful ultrasound and mammogram as one of the youngest people there. And you're just laying there in a cold room, like, is today the day? Do I have cancer? And going through that every 6 months has just been horrible for me personally. Just the fear and the not knowing, and then how is my life going to change, and just feeling like I don't have control.
Next up, I'm going to share 2 of the videos I discussed just a moment ago. I'll show you first Jasmine's Thread of Bravery video, where again, she's talking about sort of her family history and what's prompting her to go talk to her doctor about genetic counseling, genetic testing, and just finding out if, she does have a high risk.
Hey y'all, let's do a family fashion haul. This is my dad's leather jacket and I'm obsessed with it. This is one of the few jackets he has from that time that doesn't have a Jerry curl juice stain on it. A rare find. In the 80s, my parents moved from Louisiana to Texas and they went full Texan. My mom would wear this denim shirt to barbecues with denim pants and then make my dad wear the identical outfit. This is a pearl chain my mom gave me when I joined my sorority in college. She was so proud of me. This brooch is something my mom wears every October during Breast Cancer Awareness Month. She was my age when she was diagnosed with breast cancer. I was a bit too young to remember when my mom went through treatment, but she always encourages me and my sisters to stay up to date on our appointments. So this is actually what I wore to get tested for an abnormal BRCA gene, so I can understand my risk of breast and ovarian cancer and make a plan to stay on top of my health.
And as you can see, that's a co-branded material there as well, since it makes sense for that to be that way. There's also, I think, the tone of that. We really wanted to strike something that was empowering, not too light, because it's heavy to make that decision, but also, I think shows that it doesn't have to be a super heavy thing either. It can just be something that a decision you're making for your health, and then take it one step at a time, right? You don't know until you know. And next, I'm going to show you this sort of what's on her mind. Again, this is the video that's geared a little more toward maybe someone who isn't sure what to do, the sort of steps to take if they're don't have a lot of access to family history information, or just aren't sure where to start.
My doctor's gonna ask me about my family health history, but I don't know a lot about it. It's always so uncomfortable. I guess I should share what I know.
And any family history of cancer?
I think there are people in my family who have had cancer, but I don't know much more.
I'm glad you shared. Having a family history of some cancers can raise your risk of uterine or ovarian cancers. Let's talk about the information you can try to collect to learn a little more about that.
It's okay if you don't have all the answers. Talk to your doctor about family history and other risk factors for ovarian and uterine cancer.
So next up, these are some examples of how we use paid media to get our content to the right audiences in a way that is sort of relatable. So um, recently we did a Refinery 29 content partnership that dove into the generational differences in Latina communities. So it was sort of a mother-daughter article that went into their story, kind of talked about the generational differences and feelings around sharing family health history and sort of how one can influence another. The daughter can kind of influence the mother. And we were able to kind of weave in valuable facts and information for the audience within this real person to person story. On the other side, we have the inside knowledge work where we had an interactive ask an expert, and we had interactive ask an expert and quiz content. So the ask an expert content, readers could submit honest questions, and then we were able to go ahead and answer those questions. And then we had a gynecologic cancer quiz or that people, we set up and people could kind of test their knowledge. Next up, another recent project we had was developed to help those who are the first in their families to learn that they have a BRCA genetic mutation that raises their risk for breast, ovarian, and other cancers. So, being the first in your family to learn that you have that risk has health implications for the entire family. And it's such a heavy load to take on. So you've all of a sudden learned this information that you now have a high risk of cancer. Some of the women we spoke to were diagnosed with cancer and then learned that they had a genetic mutation, but some of them were previvors and learned that they had the genetic mutation based on, knowing that a lot of family members had cancer. But you're the first in the family who took that step, right? And now you have to tell family members, and some of those family members might not want to know. So it's just a lot of responsibility to put on that person who's already dealing with the fact that they have to face this risk. So we wanted to create some tools and resources for them. One of those is an interactive tool that allows you to practice having a one-on-one conversation. So it's kind of a simulation. It's called Let's Talk. And it's sort of like a choose your own adventure. You kind of can pick, this is how I would respond to that situation. And it just allows the person in a very stress-free setting to practice that conversation if they need a little bit of confidence. We also have a video series that provides tips for this task of talking and sharing health information with family members from other women who have done this. So when we sort of started to dive into the second part of this project, we really were kind of thinking, who is best to share these tips? It's really women who have had to do this before, right? Or people who have had to go through this experience, who have had to tell their family members, look, you might not like this, or some of you may be happy I did this, some of you may not, but you need to know we have this in our family. So I'm quickly just going to share one of those videos too that I think is really powerful.
My journey to learning that I was BRCA2 positive has had a tremendous effect on my family specifically. It's had an effect on my sister, who, because of her early detection of BRCA2, has allowed her to be able to treat breast cancer early. She often says, or she'll tell me, you saved my life, or you are the reason why I'm still alive. And it's really hard to accept because in my mind, like, the testing was so small, but it really puts in perspective how big it really was, because that one step led her to get genetic testing, which led her to detecting cancer early, which ultimately did save her life.
My BRCA testing results definitely spurred on my sister to be retested for the specific variant that showed up in my results. And my brother is going to get tested as well. He has children. And my parents feel that it is their responsibility to be tested as well.
I was able to uncover these risk factors for the rest of my family, and all of these amazing, strong women in my family took measures into their own hands to prevent another diagnosis in my family. I have a sister and I have 3 female cousins. We were all between the ages of 25 and 30 when this happened, and out of the 5 of us, 4 of us have BRCA1. And I'm extremely proud to share that all 4 of us had bilateral mastectomies already.
My mom and sister both decided to get tested after I shared my diagnosis. It's scary knowing that not only is my sister positive for this, but I'm at risk as well. So while it was scary, they also took the measures that they needed, the steps that they needed to.
My story has made a positive impact on my family's life. They're calling me at all times, talking about genetics with their friends and different opportunities to take it to the next level, to continue to educate, educate, educate.
So, one last component of our work that I wanted to share, and wow, this slide is busy, but there's so much to get to. So I apologize for that. But that's our entertainment education work that spans both television and gaming. So we work with television writers to encourage informative and sensitively portrayed storylines about breast and gynecologic cancers to be incorporated into television shows with the intention of educating audiences that view them. So some of our most recent storylines and successes include a 2-season-long story arc on the CW's Superman and Lois. This storyline won a Sentinel Award recently for its portrayal of Lois Lane's breast cancer diagnosis. We also had a 2-episode storyline on Grey's Anatomy. Our storyline on the Bold Type, which is a few years old now, won a Sentinel Award recently. That was a pre-Viver storyline where the main character learns about her BRCA genetic mutation. So that was an award-winning storyline as well. The current season that is on right now of All American Homecoming has a season-long story arc of a character's diagnosis that we've also been working on. And I'd like to point out too that we some of the survivors that we work with in our videos and sort of in our other work, what we'll do is we'll kind of connect them to these writers and to these actors so that they can get real sort of information from survivors and get that real feel directly from the survivors about what those experiences are like. And then we do these panels, whether it's like a panel or tip sheets or things like that. We put together all sorts of resources for writers to, again, kind of help them understand the importance of these topics and help them find ways to incorporate them in a way that's not, that's sensitive and that maybe could make sense for their shows. And one way we can do that is these panels. This is a virtual panel we did on fertility and family planning among survivors. We also did a board meeting and HHNS, I apologize, that's Hollywood Health and Society, an organization that we work with that plans these panels with us. And we also did a board meeting with them where we talked about risk among young Black women. And then we have a storyline in a mobile game called Insecure, the Come Up game. And it's a mobile game companion to the show Insecure. And there's a signs and symptoms sort of interactive component that's incorporated into the game. And that's it. I'm so appreciative of your time, and I just really thank you for giving me the opportunity to talk to all of you about our campaign work. Thank you so much.
Hi, my name is Juan Rodriguez, and I'm a cancer epidemiologist in the Division of Cancer Prevention and Control at CDC. And thank you for having me here today to talk with you about genetic testing and so give you some strategies and tips about talking with your family about genetic testing and results and the impact that could have on their health. So first, we'll start off with talking about what is genetic testing and what can we learn from it. So advances in clinical genetics have led to the availability of genetic tests to determine if individuals are at greater risk for developing certain cancers due to inherited mutations. Two of the most common hereditary cancer syndromes are hereditary breast and ovarian cancer syndrome, which are associated with mutations in BRCA1 and BRCA2 tumor suppressor genes. These are two genes that all of us have. Every person has these two BRCA genes. It's mutations in these genes that can cause an issue. And this is probably the most common or most popular cancer syndrome people have heard about. And then there's also Lynch syndrome, which is associated with mutations in DNA mismatch repair genes. Sometimes this also gets called hereditary colon cancer, but is also associated with increased risk for uterine cancers and ovarian cancers. So what's a genetic mutation? Genetic mutations are changes in a part of a gene that can alter or impact how that gene works. And so what we're going to focus on today are germline mutations, which are changes in genes that you can inherit from your parents. There are other kinds of mutation called somatic mutations. Those mutations are more about the DNA of your tumor, of a tumor itself, but we'll focus on the hereditary genes and hereditary mutations for this talk. In some cases, these genetic mutations can impact our genes to such an extent that they can increase our risk of developing diseases like cancer and Alzheimer's. There are over 30 genes associated with hereditary cancer syndromes. Now, these mutations all can do something slightly different, and they can all lead to differing levels of risk. So, for example, a mutation in a BRCA gene can cause an increased risk of ovarian cancer of up to 39%, and it can go as low as 20%, and that'll vary based on where on the gene the mutation is located. But a mutation in MLH1 gene that's associated with Lynch syndrome, that'll cause an increase of ovarian cancer risk that's up to 20% compared to someone without the mutation. So the type of gene where the mutation is and the location on the gene where that mutation is are going to determine what impact that has on risk of developing a particular disease. Having a family history of certain cancers is increased with our cancer risk as well. So it's not just about inheriting these mutations. It's also just about having cancer in the family, whether we know there's a mutation or not. So as an example, if you have one first-degree relative, so that first-degree relative is either a parent or a sibling or a child with breast cancer, you have almost a twofold increase in risk of developing breast cancer just based on that family history. If you have two or more first-degree relatives, that risk jumps from almost 2 to close to 3. Now, this is not uncommon. We estimate that almost 8% of the US population has at least one first-degree relative that had breast cancer, and almost 1% have 2 or more first-degree relatives who develop breast cancer. And you can see here the statistics for colorectal cancer. Now, over the next 2 slides, I'm going to show you the estimated risk of breast and ovarian cancer for someone at average risk compared to those who carry a BRCA mutation. They'll be presented with, on the left, it'll show you a figure explaining the risk of developing breast cancer among women who are average risk by age 70. And then on the right, you'll see the risk of developing breast cancer among women who carry a BRCA mutation by age 70. Before I show you those slides, I did want to make a caveat that risk of developing cancer is not in absolute terms, meaning that we have all sorts of risk factors that can impact our risk of developing a cancer. So it's not just genetics. It can be smoking history, exposure to radiation, physical activity, use of oral contraceptives, all sorts of things can both increase our risk and decrease our risk. And all those things impact us at the same time. It's not just genetics. So for breast cancer, if we were to pull 100 women in the general US population, we'll estimate that about 12 will get breast cancer by age 70. But if we pull out 100 women who have a BRCA1 or 2 mutation, we estimate that actually about 65 will get breast cancer by age 70. So you can see that jump from 12 to 65. When we're talking about ovarian cancer, out of 100 women in the US general population, we expect 1 woman to get ovarian cancer by age 70. But if we extrapolate that to women who carry a BRCA1 or 2 mutation, we expect we'll see about 39 women who will get ovarian cancer by age 70. These individuals with a family history of cancer or who carry these pathogenic mutations, by pathogenic, we mean that they cause a negative health consequence, may be at increased risk for adverse health outcomes. A lot of families who carry these genetic mutations, cancers are diagnosed in their families at much younger ages, and the cancers are either cancers we don't have a screening test for, like ovarian cancer, or by the time they develop a cancer, they're not yet in screening age for eligible for screening, given age guidelines for the screening test. So, for example, mammography is usually recommended starting at age 40, but women with BRCA mutations may be more likely to get breast cancer in their late 30s or very early 40s before women have started the process of screening. They are more likely to get diagnosed at later stages where the cancer is potentially more severe, which may make it more aggressive and more difficult to treat. And they can also be at increased risk for additional primary cancers. All these hereditary cancer syndromes, whether they be about whether HBOC, hereditary breast and ovarian cancer, or Lynch syndrome, can affect multiple organ systems. So it's not just a short list of cancers we worry about. So why would we get genetic testing? So if you have cancer, in some cases, that genetic test can help your treatment team figure out what treatment may be most effective for your particular type of cancer and your particular genetics. So for example, in ovarian cancer, if you have a BRCA2 mutation, it helps us know that PARP inhibitors might be an appropriate treatment option for you. It also provides your clinicians information about risk for additional cancers in the future. And that because we share genes with our family, it also provides us a great opportunity to have information about cancer risk in the family, and it's information your family can then act on. If you don't have cancer, it really helps you get a better understanding of what your risk of cancer will be into the future, and it can give you that green light to really engage in prevention and early detection to reduce your risks and catch these cancers early on. There are several types of genetic tests. Most genetic testing today, and there's been a lot of change in this because this is a quickly changing field, but most genetic tests today are done through multi-gene panels. So these are just tests that look for a bunch of different mutations in several different genes all at the same time. So you might get a blood draw or they might collect spit, and the test will look at like 30 different genes to look for mutations. However, if someone in your family has a known mutation, so someone else has had genetic testing, the provider or the doctor may order a very specific genetic test only to look for that mutation that we know exists in your family. Now, there are also direct-to-consumer tests. So these are genetic tests that are not ordered by a doctor that you can generally order on the internet. These tests only look for mutations on some genes at some specific locations and are not comprehensive. So if you do have a direct-to-consumer genetic test, you may say the result of the test might tell you don't have any genetic mutations, but it might not have looked at all possible gene locations where a mutation could exist. It might have looked at just some very specific spots. Results from genetic tests can have 3 potential results. The test can be positive, indicating that you carry a mutation that increases risk. Now, as I mentioned before, not all mutations increase risk to the same extent, so it's important to discuss the results with a genetic counselor so you have a good understanding of the risks associated with your specific mutation. You can also get something called a variant of unknown significance, or VUS for short. These tests found a mutation, but we just don't have enough research on that mutation to know if it's going to impact your health in a substantial way or not. A lot of times when future research is done and we're able to determine what this mutation might mean or this variant might mean, you'll get updated genetic testing results, or your genetic counselor might reach back out to you to let you know that, hey, this mutation is not going to impact your health, or we have more definite information about how it will impact your health. You could also have a negative result, which means that the genetic test did not find a mutation. However, a genetic counselor can help you understand what that means for your cancer risk, because getting a negative result doesn't mean you have zero risk for developing cancer. Remember, there are all sorts of other risk factors. You might still have a family history, or you could have a mutation we don't know anything about yet, so the test might not have found it. So if you carry a mutation, will you get cancer? So if you have a positive test result and carry one of these genetic mutations, it does not mean that you will get cancer. Genetic tests provide information on your risk of developing cancer. They're not a certainty. There are people who live with BRCA mutations that have never developed breast or ovarian cancer. We do these tests in order to tell us that it's important to do things to reduce our risk, but not necessarily as a peek into the future of what will or won't happen. It's not about certainty, it's about understanding risk in the long term. There are some genetic conditions, a famous one being Huntington's disease, that where if you have the gene mutation, you do get that. It does mean that you will get that disease, but the cancer-associated genetic conditions are not that kind of, are not inherited that way. You inherit risk, you don't inherit the certainty of the disease. So what can high-risk people or families do? There are several options to mitigate or reduce risk. There's health behavior change, increasing physical activity, keeping a healthy weight, drinking less alcohol or not drinking at all, and quitting smoking can be very helpful in reducing cancer risk. Getting screened for some cancers, you can start being screened at younger ages. For example, for mammography, there are women with BRCA mutations who start getting screened in their 20s. You can get screened at greater frequency. So for colorectal cancer, instead of having a colonoscopy every 10 years, you might have one every 3 or 5 if you have a mutation associated with colon cancer. Or you can be screened with different technology to improve chances of early detection. So there we might screen, instead of screening for breast cancer exclusively with a mammogram, they might also do a breast MRI. There are also medical interventions that can be done. A healthcare provider may recommend certain medications. So to reduce risk of breast cancer, there's a lot of hormone-based medications that might be prescribed. For ovarian cancer, oral contraceptives might be prescribed for prevention, or surgeries that might be recommended that can reduce your cancer risk. So removal of the breast or removal of the ovaries are oftentimes also recommended, depending on the reproductive choices women and their families are making, that can, because those surgeries will certainly reduce or eliminate cancer risk altogether for those particular organ systems. So now that we've talked through what is genetic testing, what can those tests tell us and not tell us, let's talk a little bit about sharing genetic testing results with family. So why should we share genetic testing results? So genetic or hereditary risk are potentially shared with everyone we're related to. These tests give us information not just about ourselves and our biology, but about the shared biology we have with our family. Sharing this information is another way we can help take care of our families. Genetic testing results could help our relatives' doctors provide better care by recommending cancer screening tests or other detection and prevention options. They can help your family members decide whether they should drink, change their alcohol consumption habits, change their smoking habits, their exercise habits, etc. And knowing about hereditary risk could help make genetic counseling sessions easier and genetic testing for your relatives cheaper. If you remember back to the slide where I talked about type of genetic testing, if we're looking for a specific genetic mutation we know exists in the family, it can drop the cost of testing drastically and make things a lot cheaper. So the responsibility of sharing genetic testing results with family often falls on the person who initially received genetic testing. Now, why is that? And part of the reason is the way our healthcare system is set up. Here you can see in this circle on the left, we have an individual who had a genetic test and has information about their hereditary cancer risk. Now, the healthcare system knows about those results and can offer them preventative care as for things that they're eligible for or are covered under their health insurance or that they can pay out of pocket for. So the healthcare system and the individual can talk about those genetic testing results and communicate about what to do next for the future. Now, an individual and family members can also have those same conversations because all those relatives may be at increased risk and may benefit from having that understanding of their shared cancer risk. However, due to HIPAA, privacy laws, and because a healthcare system or health insurance company may not cover your relatives, the healthcare system doesn't have a way of communicating or sharing information with your family members without you being a part of that process or essential in that communication loop in order to make it happen. So a lot of the burden kind of ends up falling to the individual. Now, this puts a lot of burden on the person responsible for discussing these inherited cancer risks for a family. And this is hard. Having conversations with family can be hard under the best of terms, let alone when we're talking about relatives and their potential risk for developing cancer. I broke things up into challenges that we can face with family and challenges we personally can face. But your relatives may feel unprepared to have conversations about genetic risk. These are complicated and intense conversations. There are relatives who may not want to know if they have a genetic predisposition or something that puts them at increased risk of developing cancer. There could also be really complicated or difficult family dynamics. Some families don't have a tradition of talking about health or healthcare. There could be closeness or distance with relatives that makes this really hard. You could be really close to a relative and that puts certain pressure on that relationship to have these complicated conversations. Or you could not have a very close relationship, so it could feel very awkward or potentially inappropriate to reach out to them to have a conversation about genetic risk of getting cancer. And it could also cause emotional distress or tension among family. These can be complicated or heavy conversations. On the personal side, a person who carries one of these genetic mutations and is maybe the only person in the family that knows about it could have the feelings of guilt or shame for passing down bad genes. They could also be afraid to give bad or incorrect information. They could also personally feel awkward reaching out to these relatives. It could also place a lot of burden on someone, especially a lot of genetic testing happens in cancer patients as part of the diagnostic workup for that cancer. So this person could be dealing with cancer treatment, making decisions about their care, trying to keep their home life and immediate family life together. And all of a sudden, this additional burden has been placed on them to also take care of all these additional relatives and have to share this additional information. And there can also be this invasion of privacy where you just learned this information about yourself, you're potentially dealing with a cancer diagnosis, and now you have to put all this out to all your relatives when you might feel like you're not ready to do that, or like this is a very private thing you're going through and you're not ready to share that yet. So what do you do if you need to share genetic testing results with your family? So I have a couple of suggestions and I'll talk about a couple of strategies that might make things easier. So the first thing I'll recommend is communicate in a way that works for you. If you're not comfortable speaking about it, it may be easier to write down what you want to say ahead of time or send an initial text or email to family to kind of prime the conversation or prepare them to have this conversation so you don't feel like you're springing something on people out of the blue in the middle of dinner. Also keep in mind that you don't need to share your results with the entire family at once. There's no need to get the entire family together to have this big conversation. If it works for you, that's great. But if it doesn't, you can feel free to start small. Maybe sit down with a very trusted or a very close relative or two and share your results with them first. They may be able to help you talk to your other relatives so you don't have to do this by yourself. Also keep in mind family dynamics. Some families talk about health issues all the time, and this may not be a big deal. For some other families, these topics could be taboo. You may need to have different approaches to having these conversations with some relatives, given these dynamics. It may be easier to talk to younger people, while it may be harder to talk to older individuals, or vice versa. It all really depends on the kind of relationship you have with your family and what's normal for your family. While the burden to communicate the genetic testing results to family might initially be on you, you don't have to bear that responsibility permanently. Relatives can help you communicate the information to other relatives. You don't have to carry the burden for everybody. And genetic testing and hereditary cancer risk, as I've kind of alluded to over these last several slides, can be really complicated subjects. It may be impossible for you to answer every question posed to you by every individual relative. Your goal really is to just give them the initial information and recommend they talk to a genetic counselor to get all the information they may want or need. It's normal to have lots of questions, and there are trained individuals out there that are specifically trained, and their job is to answer those questions and get people that information. You, as the person who got the genetic test, don't have that training and may still have lots of questions yourself. So don't feel like you need to take on the burden for being the only source of information for your family members. Bearing this responsibility could be really hard on you. People can feel guilty or like they're the bearer of bad news for their families when having to communicate with them about their potential increased chances of developing cancer. I mean, no one wants to hear that they may be more likely to get cancer, especially if they're seeing a relative go through a really hard diagnosis and treatment process. They can also feel significant worry for their children and relatives about what genetic testing results can mean for them. Remember to take care of yourself and not just your family. You might want to help seek out professional help to process and discuss some of those strategies to communicate difficult information with family. There are a lot of therapists that focus on some of these kind of complicated family dynamics and how to have these bigger conversations with family. And they could be really helpful in helping you figure out what is the best way to do this. So some specific strategies that might help having these conversations a little easier. So share your written family history of cancer with your relatives. When you have a genetic counseling appointment with a genetic counselor, one of the first things you're going to do with them is draw out a family tree and talk about the family history, the history of cancer in all your relatives. And this kind of, we call it a pedigree, but like a family tree that's about this particular disease is going to be created in that counseling appointment. You can ask your counselor for a copy of that to give to your relatives. If you're having conversations with relatives to collect this family history, the big pieces of information to collect are the type of cancer that they had, because not every cancer has a hereditary association to it, the age they were when they were diagnosed with that cancer, and what side of the family they are on. Some of the big misconceptions in hereditary diseases like cancer is that I can only inherit ovarian cancer or breast cancer risk on my mom's side. I can't inherit it on my dad's side because he's a man. Well, you can inherit risk on either side of the family. It's not unique to women. Men can pass down genes that are more likely to increase the risk of breast and ovarian cancer. We collect cancer histories from those you're most closely related to. So there'll be your parents and grandparents, aunts and uncles, sisters and brothers, nieces and nephew, and your children. There's tons of tools out there that can help you collect your family history if you need help with that. CDC has one called My Family Health Portrait that can help you collect this information and kind of keep it organized so it's easier for you to share with your doctor or with your genetic counselor and your relatives. So if you have a copy of genetic testing results, share those with your relatives. You should get some sort of lab report back with your genetic testing results. You may have to go into one of those online portals to download them so you can share so that it makes it easier for you to share. But giving a copy of that report to relatives will make it easier for them to share that information with a doctor or genetic counselor so that they can help your relative understand and explain what that means for your relative's health. It also takes some of the burden off of you on getting all the details right. There's a piece of paper that just gives the information out, and the doctor and genetic counselor can then act on it. It also helps figure out what kind of genetic test might be best for the relative. It may be they may be able to get a more specific and less costly test since they know what gene and mutation runs in the family, or the doctor might still want to consider one of those larger multi-gene panels in order to see if anything else is going on. You could also ask your genetic counselor for resources to help you discuss your results with your family. Most genetic counselors actually have resources to help you do this, and to help you have those conversations with your relatives about genetic risk. Many counselors have a letter they can give you to share with relatives that describe the test results, where they can get more information, and how to contact a genetic counselor themselves if they want to pursue testing. There's also websites that can help you find a genetic counselor by zip code or by state. Some genetic counselors may also be able to set up an appointment with you and your family to discuss genetic testing results as a group, and that way the genetic counselor can help you have some of those more difficult conversations. But different practices have different rules, so that really may be something some counselors can offer and others cannot, depending on really on how all that gets billed and stuff. There's a lot of billing that comes into some of these things. So in summary, research has shown that families who carry these mutations have lots of questions and concern. Also, given the complexity of the health issue, relatives and you could feel really uncertain about their understanding of these issues. You cannot take on the burden exclusively. Please get help from providers and relatives. You don't have to do this alone. There are things you can do, like sharing your genetic testing results and asking your genetic counselor for resources to help make this process easier on you. You have some resources there, so please make sure you use them in order to help you. And first, and most importantly, remember to take care of yourself so you can take care of your family. You need to be healthy and you need to be in a good place so that you can help your family members by communicating the information in the best manner possible and in the best way possible, in order for them to be able to make that information actionable. So you got to take care of yourself first. I do want to highlight some resources. The CDC has a campaign called Bring Your Brave to raise awareness around hereditary cancers. The link for that campaign is there. If you find yourself in a place where you are need to talk to your family about your family history of cancer, we have lots of resources to help you. We have a series of videos centered around this where women who carry BRCA mutations talk to you a little bit about the importance of sharing your BRCA testing results with family, how to prepare for those conversations and how to start those conversations with family. We also have an interactive module you can do that kind of simulates a conversation and can help you make a plan to how to manage those conversations. So please visit the Bring Your Brave website. There's really great resources on there, and there's a lot of great that campaign has a really strong storytelling focus. So there are a lot of women who have carried these genetic mutations on there, talking to you about their experiences, finding out about their mutation, sharing information with family, the kind of decisions they made to manage their risk, and what it was like doing this while managing a career and families and our children, and what it was like to do this while getting treatment and stuff like that. That can be really helpful for individuals and can bring a lot of insight and help you kind of understand that shared story. There's also resources that OCRA has. OCRA can help you and your family get access to genetic testing. They also have a program called the Staying Connected Support Series, which can be a great resource for support from others that may have faced a similar situation. And they also have a woman-to-woman peer mentoring program that can be helpful in identifying a mentor who has also had genetic testing and maybe had to have these conversations with family as well. So visit ocrahope.org for more information on some of those programs. And that's all I have. I hope this has been helpful and educational. And if there are any questions or anything I can do, the organizers know how to get in touch with me over email, and I'm happy to answer as many questions as possible. Thank you so much.